That's enough time for everyone to get back. We might kick off again. Next up is Trudy McInnis from the Department of Health, giving an update on the program. So I'll pass it over to you, Trudy.
Hello, thank you, Ben, and good morning, everyone in Queensland. I've always been a bit dubious about Queenslanders, but then my sister married one and produced Queensland babies, so who are now young men. So now I love Queensland and go Broncos. So as I said previously, I'm the Director of the Preventative Health and Renal Policy section in the Indigenous Health Division in the Department of Health in Canberra. So I'm coming to you from Ngunnawal country, and I pay my respects to Ngunnawal elders past, present and emerging, and I acknowledge all of the Indigenous people participating in this video conference today. Thanks, Ben. So what's happened over the last year? I think Tom mentioned in his presentation that we've had some data at the end of last year, some updated data on smoking rates by Indigenous people and by the ABS. And what they found was that still around 4 in 10, so 41% of Indigenous people aged 15 years or over current smokers, and 37% smoke every day. Another 3% smoked, but not every day. The proportion who smoked every day was 4% lower than the last time the survey was held in 2012-13. Roughly as many men as women smoke. It's much higher for people living in remote areas, and I think Tom mentioned as well that that's a priority, and you all know that's a priority area for us in TIS. So 49% compared to 35%. It's the lowest for people aged 15 to 17 years compared to around 40% for all other age groups. So that's good news for your young people, and it would be great to see that continue on throughout their lives, if not lower further. People aged 15 years and over who smoked every day averaged 12 cigarettes a day. Thanks, Ben. So the good news, as I said, is that proportion of people aged 18 years and over who smoked every day steadily decreased in non-remote areas over the last 14 years. The proportion of young people who have never smoked as well increased from 77% to 85% for those aged 15 to 17 years, and from 43 to 50% for those aged 18 to 24 years. Bad news, as I said, is that there's been no change in smoking rates in remote areas, which still remains really high. Thanks, Ben. What have we done in TIS over the past year? So we've expanded because of the issue with remote. We had to think about how to address that. What was needed were different interventions need to occur. Did we need to take a different approach? Did we need to do a bit more evaluation to work out what was going on? Because we had a bit of money allocated from the minister specifically to look at the two priority population groups being remote and Indigenous pregnant women who smoke. We consulted with a range of different stakeholders and experts in this field, and basically the advice that we got was that there's no reason why an intervention that might work in a regional or urban area couldn't work in a remote area. We just need to do more of it. There just needs to be a greater intensity. And so with the money that we had, we've invested in 4 sites. One was Alice Springs, so we've expanded its footprint. We've also been really fortunate to be able to now invest in Tiwi Islands in the Torres Strait and in Katherine. There was already some investment in Katherine, but not in all of it, and so now we've got some much better coverage there. We've commissioned Sturka, who does the process evaluation of TIS, and you should hopefully all be aware of them, to do more in-depth evaluation of these sites as they roll out, and to look at the barriers and enablers that they experience as they go about implementing TIS in those areas. And we've funded the NBPU to have a resource dedicated to remotes and specifically to those 4 but also to remote more generally to provide greater support to the challenges that remote organisations face in tackling Indigenous smoking. Thanks, Ben. Also, at the same time that we were thinking about what to do, the Northern Territory government was also thinking a bit about what to do, and they had a group up there that Professor David Thomas is on, and he's a smoking cessation expert nationally and internationally, particularly in relation to Indigenous people, and we've used him on a variety of different things, and he's on the ANU project that Raglan just talked about. And he spoke to us about maybe there's a forum, a partnerships forum that is held 4 times a year between the Commonwealth, the Northern Territory government, the peak body up there, AMSANT, and other, the NIAA and other related organisations. And the idea was to set up a smoking cessation working group that sits underneath that, that particularly focuses on remote. And most of the Northern Territory is remote, apart from Darwin. So we've got that up and running. We've given them a little bit of funding to get things going. And there's actually a meeting being held right now as we speak. So I had to be an apology for that to attend this, but we're represented there. And yeah, we've got great hopes for that, particularly because we've got the Territory government on board as well. And I think that, you know, it's really important to have those relationships with, because we're the Commonwealth, to have those relationships with state and territories as well, because they contribute a lot to, or could contribute a lot to this space. And there's potential, you know, we'll see how we go with it, but there's potential over time to, we know that, you know, there's a bunch of remote areas outside of the Northern Territory that need some assistance as well, and that maybe some of the learnings that we find through this project can be applied to those areas as well. And so we'll see how that goes. Next, Ben. We also convened a smoking and pregnancy roundtable. So it was chaired by, very expertly by Professor Tom. It was on the 20th of February, which seems like a million years ago now because it was pre-COVID. And we had about 35 participants. They all had done work or research in this field. So it was really nice to mix between academics and deliverers, program deliverers. We had about 15 presenters. They did some rapid presentations. The main themes that I took away from it was that we need more trauma-informed approaches for women who, you know, can be triggered. Their trauma can be triggered when they find themselves pregnant. And we need more wraparound services, improved health service and client education around how to support Indigenous pregnant women during that time, and particularly with smoking involved. We hired a scribe to take a transcript of that event. So we've captured all of the presentations in a report. We've also got videos of all of the presentations, and we'll make that available on TISRIC soon so that everyone can take something away from it if they weren't able to attend. Thanks, Ben. We've also, previously there'd been an NBPU advisory group, so that was set up especially to advise the operation of the NBPU. It was decided that the NBPU is working well and is really well embedded now in TIS, and that we probably needed to expand it and have a technical advisory group to inform the broader operations of TIS, which does have 8 components, only one of which is the NBPU, and only one other of which is the RTCGs. So there's a whole bunch of stuff that goes on in TIS, and we've now formed a really great advisory group with, you know, strong representation from different sectors and different parts of population health in the Indigenous health community and the TIS community to and academia to provide support and advice to TIS. So that we've had our first meeting of that, and that's chaired by, again, by Professor Tom. With Circa, as you would know, we finalised the performance report and activity work plans and the new monitoring and evaluation framework performance indicators, and we did a variation with you to change some reporting timelines. Thanks, Ben. We've continued, so we fund the project that Raglan was talking about. We fund Circa to do the evaluation. We work with Tom. We funded work with Tom very closely. We have a great relationship with Tom, and we fund the quit lines. Cancer Council South Australia on quit skills. We work closely and hope to be working more closely with the DSS Community Grants Hub, and we funded ISIS to quit as part of the recognition that Indigenous pregnant women are a priority population group for TIS. And I've got here handing over to Professor Gillian Gould. I'm not sure if she's in on this one today. That was a hangover from a previous presentation, so apologies for that. Thanks, Ben. Then, of course, we have all been faced with COVID-19, and I just felt so heartened by what we've heard from the various different RTCGs this morning around the workarounds because of COVID-19 and how, in fact, it's provided a good opportunity to take a breath and think a bit more strategically. That's been really great to hear. We were wondering, of course, none of us knew what was going to happen when we first started getting word about the pandemic, and we thought there might be a rush to have all any available service that's not directly related to the emergency to be reallocated to that. We've had 3 out of the 40, but really 37 asked to do that. We made a decision very early on that we would give permission to do that, but they've had to report to us on what they were doing, and we need to monitor that. And unless there's a second wave of COVID-19, I expect that will come to an end sooner rather than later. And we're really appreciative of all of the rest of you who have continued on doing TIS and doing those workarounds and finding new and innovative ways to do your work. Also, evidence has emerged that smoking may increase the risk of infection and inhibit recovery. It's a respiratory illness as much as anything. And of course that, the smoking will impact upon that. Also around, the immune system. And, you get immediate, as I know get immediate positive health outcomes as soon as you stop. So, so that's why your work is really important during this time, particularly during this time. And yeah, so if there are any more requests to reallocate to COVID-19, I suspect we wouldn't approve them at this stage. Thanks, Ben. So our plans from the Commonwealth perspective is that we're going to continue to focus on remote and pregnant women. We need to do continuous quality improvement. So the quit lines have been a bit of the poor cousins amongst us all, in that we haven't probably given them enough attention over the past little while. Need to have a bit of a look at what's going on there. Quit skills at the TIS CEO, I think it was the TIS CEO, or no, it might have been the TIS tag meeting. We had the quit skills representative talk about wanting to do a second phase of quit skills, and I think that's a really good idea. So we need to think about where to from here for quit skills. The MBPU is looking at all of your activity work plans and working out, what you're choosing to focus on, and whether there are anything that you're not choosing to focus on, and having a think about why that might be. And so it's just to get us a bit of a sense of what's going on out there in a more in-depth and analysed way. And we'll just continue to work. As I said, it became apparent to me towards the end of this financial year that we do need to do some work around underspends. And as I've mentioned previously, we'll be hopefully doing a bit of a project on that, where we work with the MBPU and FANS and you to look at ways that you can allocate any money that you might not be spending by the end of the financial year, so you don't lose it and it can be put to the best use. Thanks, Ben. Any questions? Silence is golden.
So Trudy, you're around for the rest of the workshop. So
Yes. I'll be staying on.
Wants to ask Trudy any questions offline from the meeting, there's always the chat feature to message Trudy privately. No one else will see that question if you want to keep it private, just by selecting Trudy from the to list, and then you can ask her that question directly.
Don't be afraid to ask me anything.